All right, welcome. I see a lot of new faces. This is great. Welcome to the ETGEC, the East Texas Geriatric Education Center lecture, Basic Geriatrics and Gerontology. This is an ongoing series. We're already in our 10th month. And this is covering a broad range of topics in geriatrics and gerontology. Today we're going to be talking about our third part of special populations. We've been talking the first part about older minorities. The second part, we talked about rural elderly as well as older prisoners. This time we're talking about long-term care and nursing home residents. We have three really good speakers today that will be covering a pretty broad range of topics in nursing home and long-term care. I'd like to just say that the ETGC, its mission is to provide enhanced geriatric education to all health professionals and faculty who teach in health professions throughout the East Texas region. We're headquartered here at UTMB, but we broadcast and do outreach to many sites and universities throughout East Texas, and we rely pretty heavily on distance learning. So there'll be all kinds of technological things going on today. So as always, bear with us as we try to work things out. I'd like to also acknowledge our partnership with the East Texas AHEC, East Texas Area Health Education Centers, who've been instrumental in getting this set up for us and have sites, coordinators at all our sites to help us work out the logistics and also their input. There's several learning objectives for today that are pretty straightforward. Dr. Mori is going to be talking about the first two objectives, giving an overview of the demographics of long-term care, major health conditions, et cetera. And she's going to build, this is really exciting, she's going to be building an ideal nursing home for us. This will be followed then with the next two objectives by Dr. Maria Chang Ramasut, who will be talking about the evolution of long-term care as well as some of the challenges and barriers that are faced, and basically tearing down this ideal nursing home to basically what is happening today. And the third speaker will be Maria Nelia Davis, who is our nursing home liaison here at UTMB, and she's going to be talking about her role in terms of what she does as a way of communicating and improving communication between the hospitals and the nursing homes in the Galveston County area. You have a handout, and so you should have all of this available to you here. They're on the table if you need some. If you don't have it, just follow along, and most of them will. There will be time for questions and discussions afterwards. We're going to try to follow the agenda as close as possible. There will be a break around 1 o'clock, a short break if you need. Next month we're going to be having an overview of health insurance for older adults. We have that pretty much getting set up now, and it looks like another, I think, a really good session to be held on April 8th. All of these are on the second Friday of each month. This gives you an idea of the different topics that we've been covering. We're getting pretty close to the end of what was scheduled to be a 12-month series of lectures. We're going to have some bonus lectures in the summer on other topics that we haven't been able to cover because there's just so much to do. There's so many things to cover. In June, we're going to try to put together something on sensory impairment, and that'll also not include hearing and vision, but we're also going to be looking at speech pathology as well. And then in July, we're going to have something on nutrition in aging, which is also obviously a very important topic. We have a website that explains what our program is about. This lecture series is part of a larger series of activities called a Scholar of Aging program. It's a 160-hour program, and since we are funded by HRSA, the Health Resource Services Administration, that is one of our big objectives, is to promote and provide this type of program for you. Our website describes our program in much greater detail than I could ever tell you about up here. Each month we have these topics that we're providing as part of the 160-hour program. In March, these are the activities that those who have signed up for and registered for our program and have been ongoing will be required to do as much as they can to obtain credit towards the 160 hours. Okay. As I said, we teleconference to several sites throughout East Texas, and I don't have many on there that we can see right now. We have McLennan, oops, didn't mean to do that. Sorry about that. We have McLennan Community College right here and Lamar University here. McLennan Community College is in Waco, and they're also on something we call a NetNet, and behind that is University of Texas Health Center at Tyler, and also the Sam Houston State University in Huntsville. Eventually, we hope to be connected to Stephen F. Austin University in Nacogdoches. Okay. They should be there real soon. Okay. Final feature that we offer lots of CE credits for different disciplines. Continuing medical education is offered, and we're offering 2.75 hours for this activity, for this 3-hour session. This is considered one activity for CME credit. You will, if you apply for CME credits by handing in our evaluation form for CME, you will be awarded that amount of credit at the end of the 12-month session, meaning after May. That's when everything gets handed in for the CME. Okay. This is the contact information for the Office of Continuing Education to find out more information about the CME. CNEs for nurses, we're offering 3.2 contact hours for registered nurses. This now, you don't have to be here for the full session to obtain the 3.2 hours. On the outside, there is a credit request form, and on that form has a series of the 3 lectures. Just put your initials next to the ones. If you want to apply for CNE credits, just fill that out and get those films back to me. Okay. We also provide CEUs for social workers, 0.3 credit hours. There is a separate sign-in sheet for social workers outside, as well as an evaluation form specifically for the social workers applying for CEUs. And finally, we have CEUs for physical therapists and occupational therapists. This is 3 CEU contact hours. The main thing is to hand in the evaluation form, and also there are several. Let me just get that one for you so you know which one to look for. For the physical therapists and occupational therapists, it is this form. Okay, and also have please remember to sign in on the sign-in sheets outside on the table. Okay. Are there any questions regarding continuing education or the program? Yes, Becky.
Will we be getting our CEUs at the end of the series for social workers?
Social workers, I hand in the paperwork. They tell me usually 4 to 6 weeks to get everything processed. But I need to wait on the paperwork from the other sites, so there's a little bit of a delay. So we try to send those in as soon as I get everything that I need. But you'll be on the list for sure. Thank you. Any other questions? All right, great. Well, let's get started. Our first speaker, I'd like to introduce Dr. Mori. She's recently been hired here as our geriatric medical educator, and we're really glad to have her. Let me just move this over. Do some technical. There we are. There. Okay. Just getting us set up at the other sites so they can see what we're doing. Okay. You can see there, Dr. Mori received a PhD in adult education gerontology from UT in Austin, and she now has a split appointment with us as well as the Office of Educational Development, and she's assistant professor in the Department of Internal Medicine. She's involved in many types of activities, training and education in private, public, and nonprofit sectors for over 15 years. In '93, she became primary caregiver for her mother, who had Alzheimer's disease, and 6.5 years of caregiving has influenced her for her professional career in geriatrics. Her research interests include caregiving issues, learning about spirituality, and physician communication with the elderly and their caregivers. And she also does consultation with faculty to develop teaching and presentation skills. So I'd like to bring up Dr. Mori. She's going to be talking about an overview of nursing home populations in Texas. See which one you are. Nope. There you go. Okay, I need to give you this.
I get the fun one. I
Hold
get
it,
to talk about all the
hold it,
statistics.
hold it, hold it. I get you.
Huh? I don't need it.
Nice you did.
I don't-
This is
yeah.
to record. It's not for
Oh,
amplification.
record.
Yeah.
I hate these things. Excuse me.
Sorry.
I'm going to let you think about nursing homes for a second while I figure out how to do this. Is that it? And I have to hold this? Yeah.
It has a clip, but I don't know where you put it.
There's no
Sorry.
place to click. All right, I see a lot of faces I'm not familiar with in here, so I just want to find out, how many of you in this room have had contact, either personally or professionally, with a nursing home? Okay, how many professionally? What are some of the things you have had contact in nursing homes with professionally? What type of things? I saw.
Residents, working on a study that Dr. Helliker has with story sharing among the residents and the nurse aides. So we're looking at that relationship. So we hold support forums and interventions for story sharing techniques, and we interview residents as well as nurse aides.
Oh, I want to talk to you before you leave. That sounds great. Thank you. Any others here that want to share? Yes.
Placements
All right. So actually placements from the hospital?
from the hospital to the facility, or if they came in from the facility, returned.
Return them. You hope they'll take them back, huh? Thank you. How about personal? How many of you have had personal issues or contacts? In what ways have you had personal?
My father was living in an assisted living facility, and he became a frail elder and couldn't be supported there anymore, so they decided that he needed to be transferred to a skilled nursing facility, at which point he decided it was time to die.
That did it to him, huh? Wow. Anyone else have? Yes.
Grandmother.
Your grandmother?
My mother, Alzheimer's.
Okay. What we see is that we usually have a very mixed way of looking at nursing homes, because professionally we may look at it just a little differently than we do personally. So we're going to take a look. I'm going to look at the broad base of the statistics. I'm going to look at some of the national statistics so that we can compare Texas, but mostly I'm going to focus on Texas. Most of the data that I'm using here is from the Texas Department on Aging and Disability Services, and it's actually February 2005 data, so we have pretty current. Okay, Tony, it's not working. Thank you. Okay, let's look at this nationally for just a minute. I'd like to kind of get us into perspective. Total number of nursing home beds nationally right now, or this was actually done in 1999 census, is 18,000 nursing homes. Number of beds, 1.9 million. The occupancy rate nationally is 87%. Now that's a little higher, as you're going to see in just a moment, than Texas. And the number of current residents, 1.6 million. Average length of stay is 892 days. Now, what do you think is going to happen to some of this within the next 10, 15 years?
It's going to go up.
It's going to go way up. And so it's something to think about, because what we've seen as a trend, especially nationally, is the number of nursing homes has been coming down. Even some of the residents numbers I've seen have been coming down. Why do you think they're coming down if we're going to deal with this going up pretty quickly?
There are more nursing homes.
Actually, there are less nursing homes. Nursing homes have dropped. Any other ideas?
Assisted living.
Yeah, most of it is assisted living. Financially, there's more things to keep people at home. So you see the Medicaid Waiver Act and some things like that. So what we see is there's a different dispersion. There's still the people out there, but we see less of them currently in the nursing homes. Also, another trend you see is the number of beds in the nursing homes seem to be going up, even though there's less nursing homes. Okay, let's take a look at the facilities in Texas for just a minute. First, I want to look at ownership. I found this interesting. Nonprofit, for-profit, and government. If you take a look at the ownership, we are heavily nonprofit in Texas. We are one of the highest states in the percentage of nonprofits based on highest on profit, for-profit, based on nonprofit. A lot of the states have less for-profit, and you see a larger nonprofit. just something interesting. Keep this in mind as we talk about some of the issues later, because one of the things you will see is as we look at some of the problems in nursing homes, there's been a lot of data looked at, is there a difference between profit and nonprofit? And they found, yes, there is.
Do you know what percentage that might be? I see the graph, I'm just trying to.
I can get that for you. I have it. I don't have, it may not be on the graph, but I do have it. I have all this data. If you're interested in anything, I'll be happy to get it to you.
Okay.
Let's take a look at how the licensing goes. Again, we have your Medicaid licensed bed, your Medicare only licensed bed, and your dual. Now you see the dual is quite heavy. What is a dual licensed bed?
Dual is certified both Medicaid and Medicare.
Right, so they can use it either way. You see that quite heavily in a lot of the nursing homes. Texas facilities, there is a total. Now this is in the data that we have for only licensed facilities. So if you have nursing homes that do not have licensed beds or licensed facilities, they are not counted here. This is just licensed. It's 1,110 current homes in Texas. Now if you take a look at how the payment they're getting is distributed, you see that they are again heavily Medicaid. This is not uncommon. This nationally is one of the big issues, is that most substantial payments are coming from Medicaid. Now what's happening to Medicaid?
Funds are being cut.
That's right. So we have to take a look at how we're dispersed here, and we have to think about that. And I'm going to come back to that question at the end. Let's take a look at just the cost. Average nursing home cost in Texas is $2,908 a month. Now again, these are just for licensed home. Everything I have from the Department on Aging is from licensed homes. Average daily rate is $96.93, and for Medicaid reimbursement, they get anywhere from $67 to $146, depending on the type of care that Medicaid bed is getting. Here's another thing I found quite interesting, because I just told you, everything seems to be going down. We're losing the people. But this right here is data from 1999 through 2001. And we're taking a look at the average number of certified beds by calendar year in Texas only. Now notice what's happening here at about 2001 is we're seeing the number of certified beds increase dramatically. And I found that quite interesting. That is a lot higher. I looked at it nationally too. That is a lot higher even than the national figure. But then I took a look at the number of residents in these beds. And even though we talked about things falling, take a look there at the last year. I think we're starting to see, even though the baby boomers are saying about, 2007 we're going to see them, I think we're already starting to see some trends in that.
So these are beds that are occupied, is that right?
Yes, these are beds that are occupied. Well, you brought up a good one here. Let's talk about occupied. One of the things we see here is the occupancy rate. Do you remember what the national rate was? 87. We are at 73 in Texas. And so we have right now less residents per bed. So even though you see that increase, we're still having more beds available. This is one that really surprised me, and I wanted to put up here nationally what you're seeing, is the number of Alzheimer's beds, actually dedicated Alzheimer's beds in facilities. Well, look at your national trend. It's kind of going along with the population and what we're seeing with the dementia patients, but look at Texas. They are flatlined. They are not increasing or have not increased for the last 6 years, any of their Alzheimer's beds.
So by Alzheimer's, what do you have to call, what makes it an Alzheimer's bed versus, is it a specialized unit?
Does somebody here know exactly what that is?
Yeah, I think that's the reason probably because,
It's a
you
specialized
know, you
unit?
can just say
That's what mine-
Alzheimer's if it's specialized unit.
Okay.
Yeah, I think
There are lots of Alzheimer's patients
Yeah.
in just dual
regular
residential
beds,
beds.
regular beds. But that is interesting, the trends there. Okay, let's take a look now at the demographics of the Texas residents themselves. First, I'm going to compare this to your national trends. Nationally, more than 50% of the residents in nursing homes have no other close relatives. This is something that is also a trend in Texas. They're talking about very few people in the certified facilities have visitors. 66% are widowed. 46 have no living children. The average age is 81. 82% of the residents are 75 or older. 35% are 85 or older. And at least 55% are cognitively impaired.
Oh, that was in 97.
That was in 97. It probably is where we see things going. But I think that's, again, there's some things fascinating. What does this tell us if we're dealing with or working with nursing homes? Just this data.
Means the staff, the nurses, and the nurses are going to have to be filling in these gaps for these residents because they're the only ones available.
That's right. And what's happening to our staffing, which I think we're going to talk about later. It's hurting, but it is an interesting trend, and I think you're going to see more and more of this, even though this is 97, with the baby boomers, because I've seen data where they have, they have less children because the people behind them, the group behind them, is much less in number than the baby boomers. And other things is that there's been multiple marriages a lot of times with baby boomers, so you have less children per family. This is the Texas statistics, and you see that in Texas, our average age is 80.5, very close to the same thing. And in our residencies, over 80, almost 90%, I think that's what it says, are 65 and older, and I think it's about 40% is 85 and older, very close to the national statistics on that. By gender, I keep reading that it's getting closer, but it doesn't look like it from this. They keep saying that the males are catching up with the females, but we still see that 71.3% of the nursing home residents are women, and again, this is in 2005, with 28.7% is men. They have a ways to catch up. Our nursing home by ethnicity, residents by ethnicity, again, I read a lot that we have other ethnicities, especially your Hispanic, catching up, but not looking at this. We still have 71.3% that are white. And the Hispanic population is, I believe, I can't say, I think it's the 14.4%. You're black, 13.4%, and 9.9% is other. Now, again, I think because of the mix of the people that are moving into the area, that this will change. But right now, we're still seeing quite a bit and quite heavily white. Okay, just take a look a second. These are some of the conditions that they're coming in with. Reason for admission. Now, this is nationally. Cognitive impairment, incontinence, and functional decline are some of the main reasons. Most residents at admission have more than one condition. More than half had 3 or more admitting conditions. And some of the most common diseases are your cardiovascular, your stroke, your mental and cognitive impairment, and your disorders of the endocrine system, and especially your type 2 diabetes. So, how do you think we stack up? We kind of talked about the statistics, but how do you think we stack up as far as quality of the Texas nursing homes compared to the other states in our nation?
Pretty poor.
Very poor?
Pretty poor.
Pretty poor. Pretty poor. Let's take a, this is a study, I like this group. I only took this part of it, and you'll see why here. If any of you are interested, www.healthgrades.com is fascinating because it rank orders all the nursing homes, that cities that have 4 or more actual harmful violations in the last 4 years. Now, these are your worst. 3 Texas cities in the top 10 of the worst. And I was kind of surprised that Fort Worth was so high. But none of them were in the top 10 of the best. No Texas city at all. So I think we have quite a bit to go in this area.
So that's just Houston, does that include Galveston?
It didn't say specifically what area. I can't say. I think I'm not sure. I want to say yes, I think it included the surrounding vicinity, but I'm not positive, so I'll just say that.
Have any idea of what actual harm violations, what might that include?
Oh, he's so good. You're getting me right there, I tell you. I'll pay you later, okay? Because we're going to do an exercise, right? I'm going to make you work for your lunch today. And I understand that Beth, who's been super for us, has put a handout, which is the last handout in your sheet. Now, everybody in the cities, we have 2 cities here. She didn't. Take a look in your handouts. Do you have one that says top 10 most frequent complaints?
Yes.
Okay, she told me she- okay, top 10 most frequent complaints. Everybody have that in McLennan?
No.
I can't. Do they have it there? Can you tell?
I sent it.
Okay. All right, what I'd like you to do, we're going to do just a little activity because I want you to think about this at a different level. A lot of time I can just tell you what are the worst ones, but I really would like you to think about it. So would you get with just 1 or 2 people around you? Just make some small groups here. So I'm going to give you a couple of seconds so we can get out of here. A couple of seconds. So get with some of the people that are around you. You can turn your chairs. 2 or more in a group. 2 or more in a group. What I'd like you to do, if we don't have time, is I'd like you to at least to come up with what do you think are the top 3 complaints? The top 3 complaints. I have put them in alphabetical order here. So they are not in any other order than alphabetical. If you will go ahead and take a few minutes with your partners, I'll give you about maybe 4 or 5 minutes, if we have time, and see if you can come up with the top 3. This comes from data year 2003. What 3 you came up with? So who would like to start?
We would.
Okay, what 3?
Environment, neglect, and I put insufficient staff instead of sufficient staff.
Well, that's the complaint is no sufficient
Yeah.
staff. Very good. All right, thank you. Anybody else have the same 3? Okay, which other ones do you have in yours then?
I have, say, medications, negligence, and environment.
Okay, good. Anybody have those 3?
We have medications and neglect, also quality of life.
Quality of life issues.
Right.
All right. How about, let's see, group over here.
Pressure ulcers.
Pressure ulcers.
And abuse and neglect.
Okay. Anybody else that I missed?
We have abuse and neglect and quality of care. And what else do we have? And environment.
Okay. Did you have one different here?
No, we're about the same.
All right. McLennan, did you have something different? Are they on there? I can't tell.
Hold on. Let me see if I can do it here. There they are.
McLennan? Hello? They're all leaving on me.
Someone's going to
Somebody's talking.
Oh, okay.
And there's Lamar.
How do we hear them?
She's taking the mute off. And that's Lamar there. That's Kelly, if you want to talk to
Okay.
her directly. No, I sent them the handout.
Okay, let's see. McLennan, did you have the handout? Okay, let me go to Kelly.
Lamar.
Lamar? I can't hear them. Lamar, are you there? Should we just let it go because we can't hear them? All right, I'm going to let this go because we can't hear you. Sorry. We can't hear you, so I'm going to go ahead and go on. Remember, this study, this is just year 2003 what came up, because every year could be different. Every nursing home could be different. Okay, we're back on. Okay. All right, let's take a look. How'd you do? Any surprises here?
Yeah, the verbal and abuse and mental abuse.
So low down?
Yes, because we hear it.
Okay, and the pressure ulcers being so low down? I was surprised at sufficient staff.
Yeah, and now, so,
But apparently what they're saying is a lot of them are being neglected, especially if they call someone and they need to use the restroom or they need help, they're not getting help. The activities of daily living, a lot of them are being neglected. They're not having they're not being, it's really interesting. They had this whole thing on feeding that I read, and even the feeding is an issue right now that's problems. So anyway, this is what it came up. There's no right or wrong. The main thing I want you to think about is how they rate and where we are.
Are these complaints to the state and it was founded when they were investigated?
Yes, these are complaints to the state. These are complaints to the state that were founded and reported. Sorry if I wasn't clear, but that's okay. You still had some good ideas there. So what's next? Well, we know the baby boomers are coming soon. Being a baby boomer, it kind of scares me. But let's take a look at what our government is paying right now for long-term care expenditures. They say in 2000, a little over about $130,000. Look what happens down the road at 2020. We're over $200 billion. 2040, we're almost to $350 billion. Who's going to pay for this?
we are.
Somebody. Our children. Well,
Children.
the baby boomers in Texas were actually surveyed, and they were asked, who's going to pay for it? Take a look at what they came up with. Let's let you take a second and look at that.
Nobody's thinking of children and
Savings.
Now, what I thought was interesting was savings. People that are earning less than $30,000, $30,000 a year, are thinking they're savings more than the people that are earning more. But look at the percent that haven't a clue. And they said even in some of these, the employers' long-term care, a lot of them don't have the type of care they think they have. It's not going to cover everything that they think it will. But I was amazed at this. And look at the government. I'm sure our legislature would love to see that. But it is interesting to take a look at because we know the problem is coming, and we know that right now, I do believe the baby boomers, because I am one, I don't think they want to think about long-term care. They don't think they're ever really going to need it. It's a denial. But when it comes, we're going to have a huge, huge problem with that. How are we doing on time, Tony?
Doing good. It's about 1:45.
Okay.
I was just going to ask, this is in terms of nursing home, and we see an incline of assisted living services kind of taking
Right.
this market.
Right. Actually, this was just the need of nursing home care. But still, it's still scary.
Absolutely.
What
Still
year was
scary.
this? Do you have any? Say it on.
I don't know. I had a year, and I want to say it was in 2000.
Okay.
I think it was in 2000.
You know what's interesting about the private long-term care insurance, unless Texas is different from other states, only 6 or 7% of people have long-term care insurance. So are they going to buy this long-term care insurance in the future? Or?
That's a good question, and that is true. That is about the statistics. About 7% of the people in Texas that have it.
It's also different. I have it, and you have to pay into it for years before. It's what you've paid in is what you get out. It's not an insurance policy like if you have an insurance policy and you get in a car wreck 2 weeks later, they're going to cover the bill. With long term, you have to make payments in and your coverage goes up. In other words, you may be covered for home care, but you'll be have a care provider come in. But you'll only get 7 visits before your allotment of funds run out if you haven't been paying on it since you were 19.
Right.
I think that may have been what they were saying when people really don't know what it's paying for.
Also, I'd imagine what's the chances of having employers offer long-term care insurance?
We have it here. It was offered here.
It's
This
becoming
one
more and
here.
more popular now. I think that people are picking up on it, but as any of you know that have it, it's high. It's very high. And for a lot of times, especially the people, the long-term care, the ones that are earning, I was surprised again it was that high, under 30,000, and probably dealing with a family, that's high.
But our long-term care insurance here is paid for by individuals, right?
Right.
It's not offered as a,
Right.
you know.
It's not a benefit, you pay for it.
But it gives you an opportunity to enroll people who wouldn't qualify otherwise.
Right. And it also, I think, because of the group, it gets a group base that's lower.
Uh-huh.
And I think more people are also buying this private long-term insurance, even though it's not through their employers. I know several people that are in their 50s that are now buying into this.
I have seen that too. Now, I've seen a lot of people that are waiting until they retire. But if what you're saying is true, they may be in sad shape.
It's going to be very, very expensive for those people who are much older when they got insurance.
So, some interesting things to think about. We've got one more activity, and then I'm going to turn it over. We talked about all of the problems. Can I just turn that up? With the nursing homes and some of the issues we're dealing with in nursing homes. But some of us may be there. In fact, they say probably if you're 45 or older, you will have a 60% chance you'll be in a nursing home someday. Probably all of us will be there someday in one form or another, even if it's just short term. What I'd like you to do right now, and you can just use the back of a sheet of paper, is we're going to build what you would like to have in an ideal nursing home. In other words, what would the perfect nursing home be like for you? What characteristics would you want it to have? And then I'm going to turn this over to Dr. Chong, and she's going to look at the reality to see, can we get there? So I'm going to give you just a few minutes. Just brainstorm with your partners again. What are some of the characteristics of the perfect nursing home? Thank you. Let's go ahead and wrap it up. I know this is an exciting topic, and I wish that all of you would come help build that perfect nursing home for me. Let me go ahead and get one. How about the group back here? Just give me one.
Okay, nurses that are certified in gerontological nursing.
Whoa, that sounds great. Let's start building it. How about this group here?
Okay.
Just give me the top one you'd like to have.
Quality of life service, making it more person-centered to where they're not so depersonalized.
Right, so if you'd really like to have a bath at night instead of at 4 o'clock in the morning, you could do that.
Exactly.
All right, thank you. Let's get one from this group right here.
We like to have the cosmetic service for ladies in golf clubs with guys.
Did you say cosmetic surgery?
No.
Oh.
Well, cosmetic surgery is
The cosmetics of it. Okay, thank you. I didn't quite hear correctly. Let's get the group right here in front.
2 to 3 or 1 to 2 staffing ratio nursing institute.
Oh, I love that.
Yeah, 1 to 1.
How about back in the back here?
We wanted a private room.
Okay, private room. Let's not share it with anybody.
Well, you want several. You want, I would like to have my nursing home in a good location. So, yeah.
Like the south of France.
Okay, on the beach. Good location. Thank you.
Okay, I prefer Hawaii or
I'll go along with that one. That sounds great. Nice and warm. Okay, let's get one from the front group here.
We said friendly and competent staff with low turnover.
Ooh, low turnover. Thank you. One here?
We had a number of them. Obviously, basically there were staff issues, professional staff, family involvement, leadership, and quality control, basically, is what we're.
Okay, I'm going to give you a couple on that one. Maybe. All right, we're still going. So mostly family issues and good family relations and good staffing relations.
Right.
Good. Thank you. Sure.
We thought also about having, like, as far as adequate staffing, having actually on-site physicians that are in there. It's like all-in-one care where they can have hearing, x-rays, vision, to where they don't have to go out, where it's all based.
Wouldn't that be nice? Kind of like a PACE unit in-house. Are any of you familiar with the PACE? PACE, they're really wonderful. It's all-inclusive care for the elderly. If you're not familiar, we have 2 in Texas. In some strange places, I think like Amarillo, and I can't remember where the other one is.
Maybe the physician should live in the nursing home. Remove the physician from the
Preferably to.
Only the nice ones. Can we see if any of those? Lamar, are you there? Can you give us one? Okay.
I was concentrating on really well thought out activities.
Yeah.
A really good activity coordinator that knows how to do things, that keep things stimulated
Okay.
as much as possible.
With that cosmetics and what they're playing over there? Okay, good deal.
Part of the golf would be excellent.
All right, let's get a few more.
Rehab, very good rehab unit.
Okay, rehab.
What's that good chef?
Good food.
Gardens. Some of us need to be outside.
All right, we have gardens. How about a little fire? What?
Pets. Pets.
Pets.
Children.
Children. What else?
Massage.
Massage.
Beauty shop.
Okay, one more.
Dentist.
Okay. We have now, what we've set up is the perfect nursing home. Now what I'm going to do here is just take, if you have a few questions, I think we've been kind of answering them as we go along, and then I'm going to turn it over to Dr. Chong, who will talk a little bit about the reality of what's out there in the nursing homes. Are there any questions for me?
I have one. I was just kind of curious. We were looking at the stats, and they were, thank you, licensed. Do you have any idea how many non-licensed facilities are out there, and what percentage that might be statewide?
I could not find the exact totals of it, but it's very small. The ones that are only private are it's a very small percentage.
Thank you.
I don't have, I'd be able to look for it if I could, but all I can find in,
Like 10% or smaller?
I would say less.
I just didn't know how much that we're missing of the actual population, and if it was a little bit or significant.
It's just a little, there are a lot of nursing homes in Texas that even though they are mostly private, they have Medicare beds. They don't carry Medicaid beds, but they'd still be under licensed. So the ones that are strictly not licensed, and they're talking about even working with licensing them in the future. There's a whole bunch of propositions to go up to the legislature. But if it has 2 beds that are designated as Medicare, then it's licensed. So it's just the ones that are totally no Medicare, no Medicaid.
Just one more follow-up question, if I might. In terms of the population of people that are served through nursing homes and those who aren't the same age, what's the disparity? Is there a gap?
It's very small, the number of people. I want to say that there's like 6% of the aging population. Does anybody know? I think it's 6 to 8% of the aging population is actually in a nursing home, the age group. It's very small. 5%? Very small. All right, thank you very much. I saw one more question.
I'm still trying to figure out whether or not I'm asking the same question you did. And do you know if there are the people, what percentage of people who are eligible for nursing home care that are still remaining in their homes? Does anybody know
Now
that?
that I do not know. I do not have the statistics. I'm sure they're out there. And I think if I'm correct, they're either having private care in the home or they're on a Medicaid waiver program. I do not have the statistics on that.
Okay. Any idea where I could get them?
Yes, I can give you some information afterwards.
Good. Thanks.
All right, thank you.
Very good. Thank you.
Thank you so much.